Good afternoon, everyone, and welcome back to our daily briefing. Today I'll provide the update regarding the usual set of facts that Dr. Ngozi Ezike and I present together each afternoon, and then I'll be happy to take any questions. Today we're reporting 2,126 new cases for a state total of 43,903, which includes many individuals who have already recovered. We continue to have 96 counties with known cases out of our 102 counties in the state of Illinois. 13,335 new tests were reported over the last 24 hours. And I'm deeply saddened to report 59 lives lost in the last 24 hours for a total of 1,933 fatalities in Illinois since the beginning of this pandemic. May their memories be for a blessing. In terms of the number of COVID-19 patients and assumed COVID-19 patients in the hospital in any condition, whether mild or serious, as of midnight last night, that number was 4,595. Of those, 1,267 are in the ICU, and 772 of those ICU patients are on ventilators. Stay healthy and safe, everyone. Please remember to wash your hands frequently throughout the day. Wear a face covering if you intend to be in public so that you can protect everyone around you, and maintain social distancing of 6 feet or more. Dr. Ezike and I will be back here tomorrow for our regular update together, and now I'll be happy to take any questions from members of the media. Will?
Hi, Governor. Will Jones from ABC7 Chicago. Have you seen the video circulating on social media showing a large party apparently here in Chicago? People are standing shoulder to shoulder listening to music. Granted, some are wearing masks, but most are violating social distancing guidelines. Have you seen that video?
I have not seen the video, though I did hear about it.
What is your reaction to that, people violating these social distancing guidelines and having large gatherings?
Well, first I want to remind everyone that by doing that, by standing together, not social distancing, many people not wearing masks, you're literally putting everyone around you in danger. You are. They are putting you in danger, and very importantly, all of those people are putting their families and their friends who are not there with them in danger, because COVID-19 works like this. First, you are asymptomatic. You are a carrier, and you might feel just fine, and you'll go home, you'll feel fine, and you might give it to people at home. You'll see your friends, you feel fine, you give it to one of your friends or more, and then you are a spreader of COVID-19. The whole purpose of social distancing, of wearing masks, of staying at home, in fact, is that we don't want to spread this to our loved ones or to others in the community. So I would suggest that all of those people have violated not only the intention of the order that we've put out, but also they've violated the trust of their friends and family.
Are you concerned as this order stays in place for the next several weeks, people are going to be tired of following these guidelines and more people are going to be violating them, going outside, not observing social distancing, having large gatherings? Do you have a plan in place just in case that becomes a bigger problem as we go on?
We have the ability to enforce these things. We've chosen to allow people to self-enforce, to do the right thing. We obviously have asked the police and other law enforcement to remind people when they see them, when they're not following the new social distancing norms and not wearing a mask, that they need to do those things. And then finally, the police do have the ability to, ultimately to enforce that with people, and that's, not just with the ability to remind them, but if they refuse, and if they repeatedly refuse, there is the ability by the police officers to charge them with reckless conduct and take them into custody. Though, again, we have discouraged police from doing that because we believe that people will, in general, follow the rules. But if you're putting the community in danger, as a party like that does, that should be broken up.
All right, I'll get to some other questions. This is from Greg Bishop at centersquare.com. With a hearing in State Representative Darren Bailey's challenge of your authority Monday and the possibility that other cases challenging your authority could percolate, how quickly should the state Supreme Court take up the challenge? Shouldn't they take the case quickly if this is about public health?
I think that the courts need to follow through on this. The obvious answer to this, frankly, is that the governor has the authority to issue a disaster proclamation and to put in place executive orders that are all about saving lives. We've done that for many years in this state when there have been floods or other disasters, that sometimes those floods and the disaster that's attendant with the floods have lasted for multiple months, and we've extended those orders around that. This is worse than that, and obviously has threatened the lives of 12.7 million people in the state.
This is from Benjamin Zamora, Telemundo, Chicago. Governor, with the scaling back at McCormick Place, what is going to happen with the nurses and staff hired for the 2,000 beds? Will we see any cuts there too?
We're actually redeploying many of the people that were hired for the extra beds, the ones that we're not going to build out. We're redeploying those personnel to other areas of need, including needs around nursing homes and other facilities that we have across the state where, because of sickness, there may be a reduction of staffing.
We have two questions from Amy Jacobson with WIND Radio. A follow-up from her question yesterday. Dentists around Chicago are extremely confused after your comments yesterday. They've all been waiting for your green light to open. You said they closed down on their own. Can you clarify that, please? And can they get back to work for more than just emergencies?
They can. I said that yesterday. I'm happy to reiterate it today.
Her final question, can those offices have access to the overstock of PPE?
They have their own stock of PPE. They have their own sources of PPE. As I think people know, what the federal government did with their air bridge is bring in PPE from abroad and give it to the distributors. Those are the distributors that normally supply dentists and doctors and hospitals and so on. And so there is PPE available through those distributors as a result of that air bridge. There are other facilities that don't normally carry any PPE. And those facilities have reached out to their local county departments of health, which reach then out to the Illinois Department of Public Health if they don't have enough in stock, and so we resupply them.
Okay, questions from online. Whip at the Mix. Governor, have you been watching the Michael Jordan Bulls Last Dance documentary on ESPN? If so, what do you think of it so far, and are you looking forward to episodes 3 and 4 tonight?
I desperately want to watch this. I have not gotten around to it. I have to admit I've been a little busy.
Jacob at KSDK. Have you spoken with Governor Parson about plans for Metro St. Louis and how the two states might work together in that region?
I have not. I know that he's gone in a different direction than we have. We obviously have challenges, on our side of the border. It's likely because of the differences between the two states' orders that there's been, more of a hot spot on our side, but it's unclear about that. What I do know is that we're coordinating, the county health officials there are coordinating across the boundaries.
John O'Connor at the AP. On Thursday, your team told me there were 2,250 beds at McCormick and the rest would be installed last week. Yesterday, you indicated that not all had been installed. Of the original 3,000 beds, how many are installed, and are you done installing them, and will you do any installation at Vibra in Springfield?
Again, we're keeping at bay the facilities like Vibra, with the thought that we may need to spin those up at a later date, but right now we don't need to. With regard to McCormick Place, we essentially have 2 halls. We've been working obviously across 3 different halls at McCormick Place. Original plan was 3,000 beds. We now are focused on 2 halls, 500 beds each. They're slightly different. One of them is a hall that is what I would describe as, just by visually, I would describe them as regular hospital rooms. They have, for low acuity patients that have been transferred there from hospitals because they no longer need the full breadth of offerings that a hospital has. The other hall has 500 beds, and those beds can be used either for lower acuity or higher acuity, and those are negative pressure tents over each one of these rooms, essentially, that allows the people who have COVID, maybe in a more serious condition, if they were to graduate into that from another part of McCormick Place, and it's again a higher level of care and a higher level of equipment that's in those rooms. That's what we intend to make sure are live and working every single day right now. Again, we have the ability to move into the other spaces that we had planned, but it does not appear that we will need those, at least in the immediate future, so we are not going to staff those or fully build out the rest of those.
Hannah at the Daily Line. Governor, there has been conflicting guidance from you and IDPH on who can get a test. You've said that now everyone who has COVID-19-like symptoms can go get a test, but guidance put out on IDPH's Facebook page and other places says you must also have a compromised immune system, comorbidity, or known contact with someone confirmed to have COVID-19. Which is it?
It's the former, but I also want to add that in addition to having people who have COVID-19 symptoms get tested, we also have the ability for first responders who are in any condition to get tested. We want to make sure that they have that opportunity wherever they may be, and we've expanded, as you know, across the state, places where both of those types of folks can go get a test.
Shia from Politico, what do you see as the 3 top areas that need to be addressed in a revised state budget?
The 3 top areas that need to get addressed? Well, we're certainly, revenue has been a real challenge, and we're looking for help from the federal government. I've talked about that frequently. These are, revenues that were lost as a result of coronavirus, because the budget that we had proposed originally was a balanced budget based upon the revenues that were projected to exist, in the absence of coronavirus and before we knew it. Was among us. So revenue certainly is a challenge. 3 things to cover. I'm not sure I would say there are 3. I do think that, we're looking at all the areas in which there may be need to make cuts or changes to our state budget in order to make it balanced. This is an extraordinary undertaking. And so we'll be coming out with, guidance about that as we work together with the legislature, which we're doing now, in order to put together a budget for, by the way, an adjusted budget, an adjusted situation for 2020, as well as the new budget for 2021.
Dave McKinney at WBEZ. Including today, Dr. Deborah Birx did network interviews since the president mused about disinfectant or light injections as possible COVID treatment. She hasn't disavowed his statement. Do you maintain faith in her as coronavirus task force coordinator?
She's highly educated and certainly, I think, seems to have very good intentions. So I think, I have faith in her. I must say that I personally, I think Dr. Fauci has been a very reliable source of information. I have spoken with him directly, one-on-one, a couple of times already, and I rely on the guidance that I hear from him. I rely on, what the task force, or at least I listen to what the task force puts out. And then CDC is still an excellent organization and has excellent intentions, seems to be non-political, although they've had political clampdown upon them with regard to, their interactions with the media, which is disappointing. But those are those are at least at the federal level folks that I would rely upon. I was glad to see, I think we all saw some of the facial expressions that Dr. Birx made during the comments by the president, and I think that's some indication of what her real feelings are.
One more from WBEZ. Do you have any reaction to yesterday's tweet from former South Carolina Governor Nikki Haley about Illinois not deserving federal relief because of the state's reckless spending, including on pensions?
I want to know if members of the Republican Party in Illinois agree with her, that Illinois doesn't deserve to get any federal help. That's what I want to know.
Rebecca Ansel at Capital News Illinois. Governor Pritzker answers many questions from reporters daily, and I'm wondering if there's something we have not asked about that he would like to add, highlight the importance of, or dispel in the case of rumors or incorrect information being circulated.
Oh gosh, I didn't come with an entire list of all the rumors and speculation to address. I can't think of anything off the top of my head. I try to be as transparent and as I can be and answer every question that I'm posed. I stand up here every day, probably for too long, but you all ask questions and I answer as many or even all of them actually every day.
Jim Haggerty at Rock River Times. Governor, how can gyms and fitness centers be prepared to reopen safely when the restrictions are lifted?
I think it will be obviously very strenuous. I mean, I can't tell you exactly because I'm not in that business. I don't understand exactly how all of it works. I certainly have been to a gym on occasion, and I can say that you would have to have a lot of staff, frankly, to wipe down everything on a constant basis, to make it sanitary for people. And I know that's extremely difficult. I mean, equipment gets dirty with people's, with fluids that come from people, and I think it would be just an extraordinary undertaking, but it is necessary if we were to, reopen those, and at some point, and we no doubt will, we would need to make sure that people are safe, people who work there as well as people who are using the equipment.
Mike Militich at Quincy. In the last week, the Rockford area has seen Rochelle Foods and other large facilities close or announce numerous cases of COVID-19. Are you treating these areas as hotspots? What is being done to stop the spread of COVID-19 there?
We certainly are Rockford is, if you look at the map, Rockford has quite a number of cases. Winnebago County has quite a number of cases. And so, whether you call something a hotspot or not is kind of irrelevant. The question is it an area you're focusing attention on? And the answer is, of course we are. It concerns me when there's an outbreak in one facility as well as in an entire community. So we, of course, are advising, keeping in close contact with the county public health department as well as the elected leadership in the area. And, we're paying close attention, obviously, to the food supply and the supply chain for food to make sure that it continues and that it's safe.
Okay, this is our last question from Dave Dahl at WTAX. Governor, how should teachers and administrators use their time this summer with regard to preparing for the fall, ramping up e-learning, in-person learning, both?
I would prepare for both because it is still unclear, what things will look like over the summer and the fall. But without knowing the answer, e-learning is an important thing for us to develop either way. And I think we've seen that, in this short period of time that we've been in this COVID crisis, really about 2 months, and only in a stay-at-home or at least canceling school for 5 weeks, I think. So what we've learned in that short period of time is that many schools are not ready for e-learning, but should be. And so the state actually has funds available to help school districts, to work with school districts, to help spin up e-learning. I mean, I would encourage administrations and teachers to work very hard on making sure that's available, just in case, and also because I think that in the future we'll be using e-learning more and more, even in the absence of a pandemic, along with in-person learning.
Thank you.
Yep, thanks everybody.